Okay, Alex, I want you to think about a specific, universally vulnerable experience. A moment where you are literally unable to speak. You are staring up at bright lights, and you are completely at the mercy of a stranger who is poking around inside your body.
Oh, wow. That is a very intense way to start the podcast. But I know exactly what you're talking about. It is the dentist.
The dentist? Yes. Specifically, trying to navigate a dental appointment in a second language.
Oh, that is a special kind of nightmare. On a scale of 1 to 10, my anxiety when I have to sit in that chair is easily a 9. Maybe a 10 if it is a new dentist, and I do not know the vocabulary for what is happening in my own mouth.
A 10. That is incredibly high. You are an intelligent, capable adult. You manage complex software projects. But a dental hygienist with a small metal mirror makes you want to jump out of the window?
It is not just the mirror, Sophia. It is the complete loss of control. When you are in the dental chair, you cannot talk. You cannot explain yourself. You are just lying there, mouth open, hoping you understand the instructions. In my native language, I know exactly what to do. But in English, the vocabulary is so specific, and the stakes feel so high.
I completely understand that. Going to the dentist is stressful even in your native language. The sounds are unpleasant. The environment is clinical. And you are already worried about your teeth.
Exactly. And then the dentist or the hygienist starts asking you questions while you have a suction tube in your mouth. Do you floss regularly? Any sensitivity to hot or cold? Have you noticed any bleeding? And you're just trying to nod and make sounds that mean yes or no without choking.
It really is a unique communication challenge. And dental English has its own very specific vocabulary. Words like cavity, filling, gums, plaque, root canal. It is a lot to process when you are already feeling vulnerable.
Yes, I had a terrible experience with this a couple of years ago. I had moved to a new city, and I needed to find a new dentist for a routine checkup and cleaning. I found a highly rated clinic, and I went in, feeling relatively confident.
I love this. You are being a responsible adult. Taking care of your health.
I sat in the waiting room. I filled out the forms, and then the hygienist, a very friendly woman named Sarah, called my name. She led me to the room, put the bib on me, and started the cleaning. Everything was going fine. She was scraping, polishing, asking me to rinse and spit.
The classic rinse and spit dance.
Yes, I was handling it. But then she stopped, looked at my chart, and then looked at me. She said, very professionally, "Well, Alex, your teeth look good, but I am seeing a lot of plaque build up along the gum line. We are going to need to do a deep cleaning to remove it."
Okay. That is a very standard, normal thing for a hygienist to say.
I know that now, but in that moment, my brain circuited. I knew the word plaque, but the only context I knew for plaque was a metal plate with writing on it, like an award you put on a wall, or a historical marker on a building.
Oh no. I see exactly where this is going.
Yes, I thought she was saying I had metal awards growing on my teeth. I panicked. I wanted to be polite, but I also wanted to correct her, because I am a very humble person, and I do not need awards on my gums. So, I sat up a little bit, with the bib still on me, and I said, very seriously, "No, thank you. I do not need a plaque. I am just a normal person."
You do not need a plaque.
Yes,
Alex. No.
I said it with total, sincere humility. I do not need a plaque. Please do not give me an award.
I am losing my mind. I am actually crying. What did Sarah the hygienist's face do?
She stopped holding the polishing tool. She stared at me. She looked at my teeth, then back at my face, and she said, very slowly, "Alex, plaque is the sticky film of bacteria on your teeth, not a metal trophy."
Wiping away tears. Oh, Alex, that is incredible.
I was so confused for a split second, and then the realization hit me like a truck. The dental plaque. The sticky bacteria. Not the historical marker. I wanted the dental chair to swallow me whole. I just sank back down, pulled the bib up to my chin, and mumbled, "Ah, yes. The bacteria. Please remove it."
I cannot breathe. Please remove the bacteria. You went from declining a medal award to aggressively requesting bacteria removal in 3 seconds.
I did. I spent the next 20 minutes with my eyes closed, pretending to be asleep, just praying that she would forget I existed.
Okay. First of all, that is a hilarious story. Second of all, I promise you, Sarah probably told that story at her dinner table that night. You won't believe the guy who thought plaque was a trophy.
I know. It is humiliating, but it highlights a real problem. When we are in a vulnerable position, like a dental chair, and we hear a word we only know in one context, our brains panic and apply that context, no matter how absurd it is.
That is completely normal. Plaque is a perfect example of a word with 2 completely different meanings, depending on the context. In history or architecture, it is a metal or stone plate with an inscription. In dentistry, it is the sticky, colorless film of bacteria that forms on teeth.
Yes, and if you do not know the dental context, the historical one is the only one you have.
Exactly. And this is why we need to talk about medical and dental vocabulary. Because if you do not know these common terms, you will either feel lost, or you will end up declining a bacterial trophy.
Please, Sophia, give me the toolkit. How do I survive a dental visit without sounding like I am confused about architecture?
Okay. Let's demystify this. The most common B1, B2 dental phrases are actually quite logical once you know the context. Let's start with the one that caused the trauma, plaque.
It is the sticky bacteria on the teeth. Got it. No metal awards involved.
Exactly. Now, what about floss?
I know this one. It is the string you use between your teeth. But I always worry about how to use it in a sentence. I sometimes say, "I clean between my teeth with the string," which sounds a bit clunky.
Clean between my teeth is perfectly understandable. But the natural verb is simply to floss. Do you floss regularly? Or, I try to floss every night.
I try to floss every night. That is simple and natural. What about when there is a hole in the tooth?
That is a cavity. And the dentist will fill the cavity with a filling. So you might say, I think I have a cavity. Or, I need a filling.
Cavity and filling. Those are clear. What about when they give you the shot to make it not hurt?
Ah! The dreaded shot. The natural phrase is that they are going to numb the area. So the dentist will say, I'm going to numb this area now. Or you will be numb for a few hours.
Numb. I know this word. It means you cannot feel anything. Like when your foot falls asleep.
Exactly. And if you're worried about the pain, a very natural thing to ask is, will it hurt? Or is it going to be painful?
Will it hurt? That is direct and simple. What about the rinse and spit part?
Yes. That is a classic instruction. Rinse and spit means you swish the water or mouthwash around in your mouth, and then spit it into the little sink.
I always worry I will accidentally swallow it. So I just hold the water in my mouth and look at the dentist like, what now?
Laughs. That is a very common reaction, but rinse and spit is the standard phrase. So, if we put it all together, instead of, I do not need a plaque, you can say, I try to floss every night, but I think I might have a cavity. Will it hurt to get a filling?
Wow. That is so clear. And so much less dramatic. I could actually say that without panicking.
You absolutely could. And notice how we did not use any complex medical jargon. Just simple, clear, everyday English that perfectly describes the situation.
That is a huge relief. But what about when the dentist is actually working and I cannot speak? How do I communicate if something hurts?
Ah, the communication blackout? This is a very real pain point.
Yes, the dentist will be drilling. And they will ask, are you doing okay? And I want to say, yes, but please stop for a second. But my mouth is full of tools. And I just make a muffled, sound, which they might interpret as, I am having a great time. Keep going.
I hear this so often. The key is to establish a signal before they start working.
A signal.
Yes. Before the procedure begins, you can say, if I need a break, I will raise my left hand.
I will raise my left hand. That is brilliant. It is a universal, non-verbal signal that does not require me to speak with a drill in my mouth.
Exactly. It gives you back a sense of control. And dentists actually prefer this, because it is much safer than you suddenly jerking your head or trying to speak while they are working.
That makes me feel so much better. But Sophia, I have to be honest. All of this dental anxiety, it is deeply tied to a feeling of being judged.
I hear you. Say more about that.
Well, when you go to the dentist, you feel like they are inspecting your personal hygiene. If you have a cavity, or if your gums are bleeding, you feel like they are thinking, this person does not take care of themselves. And when you add the language barrier, it feels even worse. You are already embarrassed, and now you are also struggling to explain that you actually do brush your teeth. You just have bad genetics.
That is such a profound and valid feeling. We spend our whole lives building competence and taking care of ourselves. So when we sit in that chair, and a professional is evaluating our health, it can feel incredibly personal.
Exactly. You feel like you're on trial. You think, I am an adult. I know how to use a toothbrush. Why do I feel like a naughty child?
Because the dental environment is inherently infantilizing. You're wearing a bib. You are lying down. And someone is telling you to open wide. It is designed to make you feel small. But Alex, I want to challenge that thought right now. Dentists do not judge you for having a cavity.
Really?
No, cavities are incredibly common. They are literally just a part of having teeth. A good dentist is not there to judge your past brushing habits. They are there to help you fix the problem and move forward.
That is a really nice way to look at it. I usually just assume they are silently disappointed in my flossing routine.
They are not. They have seen it all. And honestly, being able to advocate for yourself in that chair, even in a second language, is a huge sign of confidence.
I suppose so. I just need to remember that my worth is not determined by the amount of plaque on my gums.
Exactly. Your worth is determined by the fact that you show up. You take care of your health, and you keep trying to communicate, even when it is uncomfortable. And that is incredibly brave. Now, since we are on the topic of dental visits and advocating for yourself, I want to try something with you. A little role play.
Oh no. I knew this was coming. My imaginary teeth are already aching.
It will be fun. I promise. And it is great practice. I am going to be the friendly, professional dentist. You are going to be the patient. You're going to tell me about a sensitivity issue. Ask a question about the procedure. And establish our hand signal. You are going to stay calm. And no mention of metal trophies. Ready?
Okay. I'm ready. No awards. Just a normal patient.
Perfect. Shifts posture. Adopts a warm, professional, reassuring voice. Hi, Alex. Good to see you. I see on your chart that you mentioned some sensitivity on the lower right side. Can you tell me a little more about that?
Clears throat. Speaks calmly. Yes. For the last few weeks, I have felt a sharp pain when I drink cold water. I'm a little nervous about what it might be.
I understand. It sounds like it could be a small cavity. Or maybe some gum recession. I'm going to take a look. And if it is a cavity, we can easily do a filling today. Does that sound okay?
Takes a deep breath. Uses the technique. That sounds fine. But before we start, if I need a break while you are working, I will raise my left hand. Is that okay?
Breaks character. Smiling widely. Oh, Alex, that was absolutely flawless.
Really? It felt a little bit formal, but I was trying to be clear.
It was perfect. You described the symptom clearly. Sharp pain when I drink cold water. You expressed your emotion naturally. I am a little nervous. And you proactively established a safety signal. I will raise my left hand. You sounded like a highly competent, self-aware patient.
It feels much safer to have a script like that. When I am nervous, I either explain, I'm sorry, I brush every day, I swear, or I just say nothing and suffer in silence.
And both of those extremes are problematic. Over explaining makes you seem defensive. And suffering in silence is just, well, it is unnecessary pain. The clear, direct approach keeps you perfectly in the middle.
I am definitely writing that down. But Sophia, I have to be honest. Even with the right vocabulary, there is a moment in every dental visit where I just feel completely overwhelmed.
The what if it is a root canal moment?
Yes. Last year, I had a toothache that kept me up all night. I went to the emergency dentist. The waiting room was bright. The drill sounds were echoing from the other rooms, and the receptionist was asking me to rate my pain on a scale of 1 to 10. I sat there, holding my jaw, and I felt this overwhelming wave of fear. I felt like I could not even explain how much it hurt.
I hear you. That feeling of helplessness is universal. People feel it too, regardless of their native language. Have you ever heard the phrase throbbing pain?
No. What is that?
It is a very specific type of pain that beats or pulses, like a heartbeat, usually associated with a toothache or a headache. I have a throbbing pain in my lower molar.
Laughs, that is terrible. But it makes sense. When everything is pounding, and you are trying to communicate your pain in a second language, it is a recipe for panic.
Exactly. And in those moments, the most powerful English phrase you can use is not a complex medical term. It is a simple, direct statement of fact. You can say to the dentist, "The pain is throbbing, and it is keeping me awake."
The pain is throbbing, and it is keeping me awake. That is so simple, but it is so hard to remember when you are in pain.
But it is the most important thing to remember. You do not need to be poetic. You just need to be clear, throbbing, sharp, dull ache. These are all great, natural ways to describe pain.
That is a really nice way to look at it. I usually just point at my cheek and say, "It hurts very much," which works, but it feels a bit childish.
It hurts very much is perfectly fine in an emergency. But having throbbing or sharp in your back pocket makes you sound more precise, which helps the dentist diagnose you faster.
Precision solves many dental problems.
Laughs. It really does. Now, since we are experts on dental survival, I want to do a quick rapid fire scenario game. Dentist Visit Edition. I will give you a situation, and you give me your immediate, natural response. No overthinking.
Okay, my teeth are clean, and I have left my medal awards at home. Hit me.
Scenario 1. The dentist asks, "Do you have any allergies to medications? Like lidocaine?"
I would say, no, I do not have any allergies that I know of.
Perfect. Clear. Direct. And uses the natural phrase that I know of. Scenario 2. The hygienist is cleaning your teeth, and it starts to hurt a little bit.
I would raise my hand and say, "Could we pause for a second? That area is a little sensitive."
Excellent. Polite, clear and uses the hand signal we discussed. Scenario 3. The dentist says you need a filling, and you want to know how long it will take?
I would say, how long will the procedure take? I have to get back to work in an hour.
Yes, flawless. How long will the procedure take is the exact right question. And giving a time frame is very helpful. Scenario 4. You are at home, and you realize you have been avoiding the dentist for 2 years because you are anxious.
I would say to myself, I am being a bundle of nerves for no reason. I'm going to call and make an appointment today.
Gasps Alex. That is a perfect, emotionally intelligent response. You named the feeling, bundle of nerves. You challenged the irrational fear. And you committed to a concrete action? That is B2, C1 level communication right there.
Really? I just used the phrase you gave me earlier.
And you used it perfectly in context. That is how language acquisition works. You hear it. You understand it. And then you make it your own? You should be very proud of that.
I am definitely writing bundle of nerves on my imaginary dental chart.
Please do. And you know, Alex, this entire conversation really highlights something important about the language learning journey. We focus so much on the big milestones. Passing a test. Giving a presentation. But the real magic happens in these tiny, awkward, everyday moments.
The tiny moments.
Yes. The moment you ask for a filling. The moment you realize plaque is bacteria, not a trophy. The moment you confidently say, I will raise my left hand if I need a break. Those are the moments where you are actually living the language. You're not just studying it, you're using it to navigate your life and advocate for your own health.
That is a really beautiful way to look at it. I usually just think of those moments as embarrassing failures. But they are actually proof of progress.
Exactly. Every awkward question is a victory. Every misunderstood phrase is a lesson learned. You are building your confidence one dental visit at a time.
One dental visit at a time. I like that. I'm going to use that.
You should. Now, to wrap up our dental survival guide, I have to ask, did you ever get that plaque removed?
Laughs. You know what? Sophia? Yes, I did. Sarah the hygienist scraped it all away, gave me a fluoride treatment, and told me my teeth were actually in great shape. No awards were given.
That is a huge victory. You faced the bright lights. You navigated the vocabulary. And you succeeded.
I did. And if I ever go back to that clinic, I know exactly what to say. I floss regularly, but I might have a cavity. Please numb the area, and I will raise my hand if I need a break.
Laughs. That is the smartest thing you could possibly say. Thank you. Alex, this conversation was exactly what I needed. I feel so much more confident about the idea of going to the dentist and not feeling like an alien in the chair.
I am so glad to hear that, Sophia, and to all our listeners out there. If you feel anxious about going to the dentist in English, remember this: it is okay to ask for clarification. It is okay to establish a hand signal, and you never ever need to decline a bacterial trophy.
And if the hygienist asks about your plaque, just remember, They are talking about the sticky stuff on your teeth, not a historical monument.
Exactly. We will see you all next time. Keep your teeth clean, your hands ready to signal. And bye, Sophia.
Bye, Alex.